Introducing the Hanaro stent for the esophagus. For the upper part of esophagus. Fully covered, a lasso for repositioning and an asymmetric head for the upper part of the esophagus. A symmetric head is specially designed to be placed near to the upper esophageal sphincter. 12 radiopeg markers provide maximum visibility under fluoroscopy. For the middle part of the esophagus. The bone-shaped proximal end aids minimal granulation of tissue. The unique nitinol hook structure with small cells provides a long-term stent patency. This is another covered stent with a special feature, a segmented body. This is the esophageal bone-shaped, partially covered stent. Partially covered ends aid the prevention of stent migration of a covered stent. For benign esophageal disease. Outer silicone coating blocks the direct contact between mucosa and nitinol wire. It allows you to easily remove the stent. For esophageal bariatric surgery complications. Place above the cardia junction. Distal bone shape of duodenum to absorb the peristalsis or to avoid the mucosa to be in contact with the stent. This is a delivery device for the HANAROSTENT Esophagus. A red marker indicates the recapturing limit or point of no return. The locking system prevents accidental deployment during placement. Flexible olive tip. Here are necessary tools for a stent procedure. Cannulation catheter. 20 cc injector. Contrast medium. Saline solution. 0.035-inch guide wire. Here is a short overview of esophageal stenting. Advanced endoscope. Insert guide wire. Insert the catheter through endoscope. Slowly advance the guide wire and catheter. Inject contrast medium. And check the lesion size through fluoroscope. Withdraw the catheter and the endoscope. Lipiodol subcutaneous injection is the first preferred option in order to get an accurate stent positioning with fluoroscopy guidance. Inject lipiodol on the lower part of the stenosis. Inject lipiodol on the upper part of the stenosis. A metallic paper clip is another preferred option in order to get an accurate stent positioning with fluoroscopy guidance. Directly fixed with transparent tape on the patient's skin on each end of stenosis. Before introducing the stent, please choose the stent with a length at least 4 centimeters longer than the actual stricture. Now, take the delivery device out of package. Inject saline solution into the hole of delivery device to make sure that inner path of the delivery device is smooth and clear. Advance delivery device along the guide wire. Advance endoscope. Remember that the red marker indicates the point of no return. Check the location of olive tip. Loosen the safety lock by turning it counterclockwise after checking the location of the stent. Hold the inner shaft handle firmly with one hand and then gently pull the outer sheath handle. Before pulling the outer sheath handle beyond red marker, the stent is always resheathable by pulling the outer sheath back. Check the endoscopic view of full deployment and drainage. Here are tips for stent removal. Using a snare. First, close the upper part of the stent by catching and pulling the lasso. Second, pull out the snare inside the working channel. Third, hold firmly the endoscope and the snare together. Move back and pull out the stent. Thank you.